Calf augmentation. Dressings. Usually tape is placed over the incisions. Tape should be left in place until it is taken off at your 1-week follow-up appointment. Sutures. Sutures dissolve usually in about 2 weeks. Wound care. Tape should be cleaned in the shower daily by lathering with soap and water. Tape can be dried by blotting with dry towel or by using a hairdryer at a low setting. Do not use the heat setting. Once your surgeon removes the tape, the incision should be cleaned with diluted peroxide and coated with antibiotic ointment or ScarGuard as instructed. Activity. Increased activity is tolerated with no heavy exercise or lifting for at least 2 weeks. Be sure to move extremities, i.e., rotate ankles and flex knees during this period of decreased activity, as this promotes good venous return and helps prevent blood clots. Avoid driving while still taking prescription pain medication. What to expect? Swelling, bruising, and some bloody drainage are normal. As numbness subsides, it is common to feel tingling or sharp sensations. These sensations will eventually go away. However, it may take months to resolve. Special instructions. Wear supportive hose full-time for 1 week and at least half-time for 2 more weeks. Please purchase these items from your local drugstore before surgery. Prescription medication.